Hello, my name is Sean Case, and today I'll be addressing the Radiology Technologists and how their work pertains to transgendered patients as opposed to people who are not transgender. And to differentiate that, we'll start by defining the difference between sex and gender, because sex is something that is determined genetically, whether you have XX chromosome, which would make you female, or XY chromosome, which would make you male. And that's different from gender because gender is a social construct because it's how your society views you and the roles that they believe you should fall into. And sometimes that is based on the sex that you are. So there are people that do not follow the traditional roles and they feel that their gender is different from their genetic sex, and that is what a transgender person is. They don't fall into the traditional roles that people prescribe to. They have their own roles that they follow, and that can create some instances where care does need to be altered. And to help me address this, I have brought my mom, who is a radiology technologist. Her name is Jeanette, and I'm just going to ask her some questions as to how her job pertains to the transgender community. So, what is an important difference that is crucial to the work you do, whether you're dealing with a transgender patient or someone who is not transgendered?
Well, there really is no difference between addressing the issues of gender or transgender patients. It's a matter of normally a nurse would give me a heads up saying that this person addresses themselves by this name, which is not the name on the chart, and that they were transgender, so treat them to the gender that they wish to follow, which is what we do. So what I would do in that situation, first I identify myself, as I greet the patient, tell them what procedure we're going to be doing, and then I ask them, what is your name? And they'll say, Jennifer Smith. And I'll look on the chart and it says Jeffrey Smith. So I'll say, may I look at your armband? And I verify that the armband and the requisition are the same.
Okay, so as to make them comfortable with the situation, because anytime you go to any kind of doctor and get a procedure done, there is that level of discomfort. So by addressing them the way they like to be addressed, do you think it makes them more comfortable with the situation?
Oh yes, most definitely.
Okay. And then as it occurs to like the management perspective, when you are reading a chart, if it doesn't specify whether they are male or female, or if they are in transition, is there any procedures that you do that would be different if you were dealing with a genetic male versus a genetic female, or someone who is transgendered and they are genetically female but they prescribe to being male, and vice versa?
There's really very little difference. It only comes physically, the differences of being male and female. So the genetic portion of it.
Okay.
For example, the pelvis on a male is a little bit larger than the pelvis on a female. So when we go for our markers of, where to position for doing a pelvis exam, we, if you'll step this way, you palpate the ASIS, which is right here, and then you go down, for a man, you go down a little bit more than 4 inches, and that would be pubis symphysis, which would be the end of the pelvis. Whereas with a woman, you end up only going about 4 inches instead of 4.5. So it would be a minor, basically I can't say it, inconsequential difference.
Okay.
Sorry.
Now, when you ask certain questions, because I know anytime someone who's female goes in for an x-ray, you do have to ask them if there's the possibility that they're pregnant. Now, if you were to ask that to somebody who you don't, like, based on how they appear, they look like they're male, or whether they are a genetic male or they are transgendered, and they prefer to be addressed as someone who is male. If you were to ask them, is there a possibility that you're pregnant, do you think that anyone would find offense to that question? Or in your experience, has anyone in the past found offense to that question?
No, most of the transgender patients that I deal with realize we still have to worry about pregnancy. So asking a transgender woman if there's a possibility of she being pregnant, she'll then just answer the question. And with a transgender male who appears female, we ask the question and they just, very politely say, no, there's no chance I could be pregnant.
And then if you ask somebody who was genetically male and they weren't transgender, have you ever experienced somebody being insulted or offended by the question? Or...
No, most of the time it's just laughed off.
That's good. Now, the procedures that you have just discussed, is that standard procedure that everybody gets trained in? Or is it just something that, in your experience, you have picked up these traits along the way?
I've picked up these traits along the way. The standard professionalism and being polite is what the training is. And dealing with the transgender community, which we haven't really had much of an opportunity to in the beginning of my career, you just make those minor adjustments now.
Now, do you think a patient is affected in the transgender community by your professionalism? Like, do you think they are more likely to return to your hospital because of the level of comfortability that you provide?
I believe that's why they come back, yes.
Well, thank you for your time. I appreciate you. And that was to address the issues that you may face when helping the transgender community as a radiology technologist.